I'm Kennedy Hewitt, and today I will be discussing the use of electrolyte panel blood tests and their importance when determining and treating cardiovascular health. So first, let's talk about what an electrolyte is. Electrolytes are minerals within the body that naturally have either a positive or negative charge. They work within the body by conducting electrical charges through the movement of ions in order to regulate many different things such as pH balance, hydration, and chemical reactions that lend support to the nervous system and musculoskeletal system. At the most basic level, electrolytes are responsible for maintaining an overall balance or homeostasis within the body. We typically receive a majority of our electrolytes through our diet, and imbalances in these electrolytes within the body can lead to potentially harmful consequences on our health. I want to place focus today on two different electrolytes, the first being sodium. Sodium is extremely important to our bodies as it plays roles in various functions from nerve function to muscle function, fluid balance, blood pressure maintenance, as well as hydration and nutrient intake in the body. The next electrolyte I want to discuss is potassium. Much like sodium, it plays important roles in bodily functions such as nerve function, muscle contraction, movement of nutrients and waste into and out of cells, as well as regulation of your heartbeat, which I will be going into a bit more later. So what is an electrolyte panel? It is often also referred to as a serum electrolyte panel and is typically included in many of the routine blood tests that are done on patients, such as comprehensive metabolic panels. This blood test is used to determine the levels of all of the key electrolytes in the body, like magnesium, calcium, and chloride, as well as the previously mentioned sodium and potassium. This test can be ordered to determine the levels of all of these electrolytes at one time, or if a physician has a concern about a specific one, it can be tested individually. Physicians will typically order an electrolyte panel if patients are exhibiting symptoms that are consistent with an electrolyte imbalance, such as fatigue, nausea, headaches, confusion, muscle weakness, fast or irregular heartbeat, numbness or tingling, or convulsions. Typically, many of these symptoms on their own may not immediately point to an electrolyte imbalance. However, if they are persistent or paired in combination with each other, it is a good indication to doctors that this test should be done. There is also an increased likelihood of this test being ordered by a physician if a patient has a history of problems related to an electrolyte imbalance, or if they are currently taking medications such as diuretics that are known for contributing to an imbalance in electrolyte levels. So focusing on how the cardiovascular system is impacted by electrolytes, they play a very important role when it comes to action potentials within myocardial cells. When considering a heartbeat, it is a two-part pumping action of an atrial contraction and a ventricular contraction, which are controlled by the cardiac conduction system. This system, like many other parts of the body, uses electrolytes to spread action potentials through the heart in order to produce those muscular contractions that we recognize as a heartbeat. As we can see by the graph on the slide of a myocardial cell during the progress of an action potential, the sodium current is what initiates and progresses the action potential, whereas potassium plays a very key role in repolarizing the cell. So it's easy to understand how imbalances in these two electrolytes can lead to difficulties in action potential propagation and repolarization, causing abnormalities in the ability for muscle contraction to take place in a smooth and timely manner, ultimately leading to arrhythmia. It is also important for me to mention that potassium and sodium have an inverse relationship within the body. Much like in the propagation of action potentials where sodium leaves and potassium enters, it is typically seen between these two electrolytes that if one becomes highly elevated, it can lead to a significant depletion of the other, and a patient can be left dealing with an imbalance in both electrolytes, as these effects can manifest and have serious consequences on the cardiovascular system. The normal range of sodium that is expected upon completion of an electrolyte panel is between 135 to 145 millimoles per liter. Levels above this are typically categorized as hypernatremia, which can lead to the body having a hyperosmotic environment, ultimately causing cell shrinkage. This decrease in cell size leads to a reduction in conductance, ultimately causing hyperpolarization of the resting membrane potential in cells. These disturbances in action potentials typically mean that a patient experiencing hypernatremia can have problems such as arrhythmia, elevated cardiac enzymes, and cardiac contractile dysfunction. On the other hand, patients can present with sodium levels that are too low, and that is characterized as hyponatremia, which can cause impaired water excretion, an increase in arginine vasopressin within the body, causing cardiorenal insufficiency and low cardiac output, as well as a reduction in cardiac contractility. Patients are also likely to experience problems in relation to heart function. However, this condition is not as common as hypernatremia is. The range is considered normal from an electrolyte panel when looking at potassium is between 3.6 and 5.2 millimoles per liter. Levels above 5.5 millimoles per liter are classified as hyperkalemia. These increases in potassium levels can lead to slowed conduction to complete conduction blockage and cause patients to experience asystole, irregular heartbeat, and congestive heart failure. Hyperkalemia can also be visible on an ECG through a tall peak T wave, prolonged PR intervals, and widened QRS intervals. If potassium levels peak too highly at 8 millimoles per liter, total cardiac arrest can occur. On the flip side, patients with a potassium level below 3.5 are considered to have hypokalemia. When this happens, muscle cells are unable to properly repolarize, and this can cause resting membrane potential hyperpolarization, as well as sodium-potassium ATPase inhibition, suppression of potassium channel conductance, and a prolonged action potential duration, which can be noted on an ECG through the appearance of an inverted T wave, prolonged QT interval, and depressed ST segments. Hypokalemia can ultimately lead to atrial fibrillation, multifocal atrial tachycardia, and an increase in premature ventricular contractions. Following the inverse relationship that appears between sodium and potassium, hypokalemia is much more commonly seen in patients than hyperkalemia. Any way that you look at it, imbalances in either or both of these electrolytes can lead to serious consequences within the body, typically seen through arrhythmias due to action potential disturbances. These problems are why an electrolyte panel blood test is so important, as it allows for physicians to diagnose and treat these imbalances before they lead to life-ending consequences like cardiac arrest. Thank you for listening, and I have linked all of my resources here if you are interested in learning more about the role that potassium and sodium play in the cardiovascular system.